Overcoming health anxiety, understanding the roots, effects and path to recovery. Hi, I'm Dr. Tony Weston. Today we're diving into a topic that affects millions of people, health anxiety disorder, previously known as hypochondria. It's more than just being overly concerned about our health. It's a persistent and overwhelming worry about illness that can severely impact our quality of life. But why does this happen? What are the roots of this disorder? And most importantly, how can we overcome it? Let's explore. Health anxiety disorder is characterised by an excessive preoccupation with having or developing a serious illness. This worry often leads to frequent doctor visits, constant symptom checking, and sometimes avoiding medical care altogether out of fear of what might be found. But where does this anxiety come from? Let's look deeper. Health anxiety doesn't just appear out of nowhere. It often has deep psychological and emotional roots. For many, it can be linked to a heightened sensitivity to bodily sensations. These normal physical sensations, like a headache, slight chest pain, or even just feeling tired, are misinterpreted as signs of something much more serious. This misinterpretation is often fueled by underlying anxiety, catastrophic thinking, and a lack of ability to process normal human emotions. One of the core contributors to health anxiety is trauma, especially complex trauma from childhood. Children who grew up in unstable or unsafe environments often develop a hypervigilant state of mind. They're constantly on the lookout for danger because their early experiences taught them that the world is unsafe. This hypervigilance extends into adulthood and manifests as an overfocus on bodily sensations and health fears. Neglect, emotional unavailability of caregivers, or chaotic family environments can create a sense of uncertainty and anxiety that persists. When we learn as a child that our emotional and physical needs may not be met, we can develop a deep-seated fear that something bad is always about to happen, including to our health. Attachment styles, which are formed in early childhood, play a significant role in how we relate to ourselves, other people, and the world around us. Those with anxious or disorganised attachment styles may be particularly vulnerable to health anxiety. Anxious attachment often leads to seeking reassurance, whether that's through constant doctor visits or symptom checking. Disorganised attachment, often a result of trauma, can make it hard to regulate emotions, leading to exaggerated health fears. When we grow up in environments where emotions are dismissed, minimised, or even punished, we don't learn how to process our feelings effectively. We might suppress emotions like fear, sadness, or anger. This emotional suppression can lead to physical symptoms, tightness in our chest, headaches, stomach pain, that become triggers for health anxiety. Without the tools to process emotions, we can misinterpret these sensations as signs of illness. So how do we overcome health anxiety disorder? Here are some steps that can help, ideally as part of therapy that includes and is not limited to the following components. 1. Recognise the patterns. Understand our triggers and the cycle of thoughts that lead to our anxiety. Awareness is the first step. 2. Emotional processing. Work on processing emotions that you may have been suppressing. This can be through therapy, journaling, or even talking to a trusted friend. Learning to identify, name, and express emotions in a healthy way reduces the physical symptoms that fuel anxiety. 3. Working with cognitions to help us reframe catastrophic thinking and challenge unhelpful beliefs about our health. 4. Mindfulness and relaxation techniques. Practices such as mindfulness, meditation, and deep breathing can help us stay grounded and reduce the urge to panic over normal bodily sensations. 5. Limits reassurance-seeking behaviour. Constant checking and frequent doctor visits only reinforce the anxiety cycle. Gradually reducing these behaviours can help lessen anxiety over time. 6. Attachment-focused work. Understanding and healing our attachment style can reduce anxiety and help us develop healthier ways of relating to ourselves and others. 7. Gradual exposure. Instead of avoiding health-related triggers, gradual and controlled exposure to them can help reduce their power over us. Health anxiety is not just about fearing illness. It's often about unresolved trauma, unprocessed emotions, and a learned response to stress. By addressing these root causes, we can start to break free from the cycle of fear. Remember, you're not alone and help is available. I wish you well on your journey to recovery. If you found this video helpful, please like, share and subscribe for more insights on mental health and emotional well-being. Thanks for watching.